Resident doctors in Nigeria's public hospitals began an indefinite strike today over grievances that include the delayed payment of salaries and allowances. The Doctors Union, National Association of Resident Doctors, NARD, says that the country is facing rising COVID-19 infections. Nigerian doctors frequently strike over what they say are poor conditions of service. The president of NARD says that government has not reached out to the unions since it gave notice of the strike action. Last year, they walked out from their jobs 3 times, including over demands for an allowance for treating coronavirus patients. For more on the story, we're now joined by Dr. Emeka Ugwu, who's the president of the Nigeria Doctors Forum, SA, on the line from Pretoria. Thank you very much indeed for joining us, and welcome to the program.
Thank you so much, and good evening to your listeners.
So it's quite concerning that doctors in Nigeria have had to go on strike again. And as we were just reporting, that this happened 3 times last year. So this is sadly something that's becoming all too familiar. Does that suggest that the authorities are either unwilling or unable to deal with the issues that the doctors are raising?
Oh, yeah, it's a concerning situation, and I must say that it is a reflection of the decadence in the Nigerian system across various sectors over so many years now, where the government hasn't paid enough attention to the decaying system in various segments of the country, which is reflecting now in the health system, unfortunately.
Doctors are critical care workers, and often in countries, critical care, critical service personnel ought not to strike. Do you think that the doctors are justified in taking such action, especially in the middle of a pandemic, and also that lives could be compromised?
Oh, yes. It is a big problem, and it is a concerning problem for the Nigerian population, for the Nigerian patients. Unfortunately, though, one should look at it from an unbiased perspective. You know, when a doctor is being owed for 19 months, for example, or for 8 months, or for 4 months, or for 2 months, as the situation is currently in certain Nigerian states, then it becomes a difficult thing for anyone to expect the same doctor to come to work on a continuous basis to discharge his duties the way it should be, while probably he's got a family to cater for. I mean, it takes an average of 6 years to train a doctor, and by the time you come out, the expectation is huge on your side in terms of supporting your family and supporting even the extended family. And there's no way one could continue working without appropriate remuneration, unfortunately so.
Do you think that lives are being put at risk and patients suffering as a result of this strike?
Obviously, yes. They say when 2 elephants are fighting, it's the grasses that usually suffer. I mean, the strike that started by 8:00 hours this morning is across the whole Nigerian state, in all the teaching hospitals, all the government-owned hospitals where you have resident doctors. And it's a total shutdown. It's not a partial strike. So it's a total shutdown, meaning that the resident doctors completely dropped their tools. So this is at the expense of the patients, unfortunately.
What are the authorities saying? Because we understand from the president of the Doctors Union, NARD, that once the strike notice was given, the government didn't bother to contact them or reach out to them.
Yes, there's been a recurring decimal, actually, unfortunately. So I spoke with the Nigerian Association of Resident Doctors president this evening, Dr. Uyiwala, and he did mention that since the strike started this morning, the government hasn't reached out to them. And this is actually a culmination of failure, from what I understood, on the side of the government to fulfill the agreement they reached in April. Because there was a strike in April, which, for what I understood was from the 10th of April until the from the 1st of April until the 10th of April, they reached agreement with the government, and they signed what they called a memorandum of action with the government on the 9th of April. And between the 9th of April, then they called off the strike on the 10th of April. From that time until now, the last meeting they had in Omahia, the capital of Abia State in eastern part of Nigeria, from the 26th of this month until the 31st, when they declared that they are going to go on strike. So from that time in April until now, the government hasn't gotten back to them, and all the agreement they reached hadn't been implemented.
Please help us understand, how does the largest economy on the continent and one of the largest oil producers in the world fail to pay its doctors?
Yeah, that's the irony of it. As I said, it is a reflection of the bigger problem in the Nigerian state that is across board. We're talking of poor infrastructure. We're talking of poorly maintained infrastructure. We're talking of poor salary across board. We're talking of insecurity. We're talking of brain drain. We're talking of increase in exchange rate. We're talking of dwindling economy, amongst so many other problems that are bewildering the country. So it is unfortunate. We are blessed with human resources. We're about 201 million persons. We've got a huge quantity of all sorts of minerals that God bless us with, but we are failing to manage them properly. And it's not about this present government, in all honesty. It's been happening, as I said, from when I started. It is a reflection of the decadence over so many years, unfortunately so.
And I suppose doctors, when they're not getting paid after, as you say, 6 years of study, they'll be left with no option except to leave the country. And that, of course, puts even more strain on healthcare in the country.
Absolutely, yes. In addition to that, not creating appropriate infrastructure where they could study and gather more skills in terms of their training, residency training, and ensuring that after the training that they have a position where they could work and contribute back to the economy of the state. In addition to insecurity and so many other problems that the country is battling with. Of course, an average person who's got the means would think of how best to support his family, and a very attractive option is to leave the country, unfortunately.
Dr. Ugwu, let's hope that some resolution can be found quite soon for the sake of not just the doctors, but the millions of patients across the country. But thank you so much indeed for giving us some insights on the situation in Nigeria.
Thank you so much, and have a good evening.
Thank you. That's Dr. Ugwu speaking to us about the nationwide strike by doctors in public hospitals in Nigeria.